I'm Carrie Peterson with Superior Reach, and today I would like to welcome Dr. Marcia Bisel. And
Hi.
she is joining us, and we are going to talk a little bit about today. She has been in the veterinarian industry for a very, very long time. So, Dr. Marcia Bisel, can you go ahead and share with us a little bit about yourself and your history in the veterinarian industry? Now, how many years have you been practicing?
I was just thinking of that this morning, and it is up to 22 years.
That's a very long time. Now,
Yeah.
when you graduated, did you practice in one certain area? Did you specialize in anything, or have you just been practicing general small animal? Do you work with large animal? What do you do?
Well, when I went to veterinary school, basically you had three tracks you could go: large animal, small animal, or mixed animal. And
Mm-hmm.
I went to mixed animal because I really didn't know what I was going to be doing after. But I kind of assumed I'd probably be going more the dog and cat direction, which I did. So I've pretty much done general small animal practice and surgery that entire 22 years. Yes.
Okay. And you've practiced in this local area here?
Yes. I've been in Minnesota, Northfield, Minnesota all along. So,
Okay. And in your years of practicing animal medicine, what advice would you give? Like if somebody was recently graduating, what advice would you give a recent graduate?
oh man, that could be a really long answer. I was thinking about it this morning of what I wish I'd known when I first started practicing. And I think much of this you just have to learn, by experience, no matter what you do. But um, I think, there's a big emphasis right now in the veterinary field about mental health of veterinarians because it's become a big concern within the field. There's a high number of people that seem to want to leave the profession, and there's a high number of people that suffer with depression or just major burnout. There's a high suicide rate for the profession relative to other professions. So it's very sad that is the case. And of course, there's been a lot of questioning, well, why is that? And you know, I certainly experienced a lot of those things, like I mentioned, burnout and all of that, especially early on in my career. And so, probably what I would tell someone from a personal standpoint going into this career is you really have to be careful with boundaries. I say boundaries and learning what I could and couldn't control were huge for my personal well-being as I practiced. And that took me a long time to kind of figure out that balance. I wanted to save the world. I wanted to save every dog and cat. And no matter who came to me with whatever problem, and no matter how little or how much resources they had to care for their pet, or how much they even cared for their pet, I would say that I probably cared too much at times, and that if that makes sense, because if you care more than the owner does for their pet, that's just a recipe for major burnout because you're going to be trying to address something that they're really not that interested in addressing maybe with their pet. And you have to let go of that responsibility of thinking that every pet out in your town is your responsibility to fix. And I struggled with that. But once I learned that, I remember feeling much healthier. And I would also say I think if you don't worry as much about knowing every little detail of veterinary medicine, you come out of school and your brain's like a textbook, and um,
Yeah.
you sort of think that's what it's about. At least I did, because that's the emphasis at school. So much is knowledge and skills and all of this. Obviously, that's what you're there for, to learn all of that. Um, and then in the real world, you get out to your job and, you can feel like you just never know enough. You can feel very incompetent, maybe compared to this person, doctor over here. And I struggled with that confidence for a lot of those reasons, and comparing myself to other vets and thinking, oh my gosh, they're so much smarter than me. They're such a better surgeon, whatever it is. And I would say, try not to go that route in thinking about it, and really think about what your strengths are, because what I've realized is everybody has their own style of practice.
Mm-hmm.
And the the pet owners are not analyzing us on all of our knowledge.
Yeah,
If they knew all of that stuff, they'd be veterinarians themselves. They're
correct.
looking for somebody who cares. There's that old phrase, oh, how does it go? They don't care what you know till they know that you care. I think a lot of people have
Yeah.
heard that. And that is especially true, I think, in this field. And if they know you care and you're on their side and you're working as a team with them to help their pet, and you're looking out for their best interest and their pet's best interest, the rest in my mind becomes pretty secondary because you will have a loyal clientele you'll enjoy working with and they'll enjoy working with you. And that is what makes the job fun, in my opinion, versus, being able to spew out a ton of facts, I guess. So
And
you
I
can
think,
always look things up, but the relational part
I think
is the
yes.
piece that has to come from you. Yeah.
Yeah, and I think one of the things that amazes me about veterinarians is their gift of empathy. So in
Yeah.
order to love animals and treat animals who really can't communicate,
Mm-hmm.
you have to be very in tune and have a very empathetic
Right.
attitude and spirit. And I think that showing that to your clients is the key
You're
for
right.
them to trust you
Mm-hmm.
and to listen to what you say
Yep.
explicitly, for treatment of that animal. So I can certainly see how they would become tired or burnt out very quickly.
Right. Mm-hmm.
So it's, building that relationship is what I'm hearing from you, and
Yes.
communicating with the owner, but also letting them own their part and
Yes.
doing the best you can with the
Right.
tools that you have and what they're allowing you to do.
Exactly. Yep. And I mentioned boundaries, and what I'm thinking of when I say that, because this took me a long time to learn too, is you don't have to give your phone number and your email and your text to every client. And
Yes.
I think, especially when you start, that could be a really easy temptation because, like you said, the profession tends to attract very empathetic, caring people
Mhm.
who just want to fix it and make everything better and whatever the case may be, and just want to be able to talk to that owner the minute they have a question or whatever. But speaking from experience, that can get out of control very quickly.
Yeah.
And I've known veterinarians who gave their number to anybody, and then their weekend became sadly controlled by answering texts and emails. And that's not what you want. You need a break too. And you need to not feel bad about that. So I learned to be very careful who I gave that information to. And even when I did give that information, it usually was because there was a complex case with their pet and something where we did need maybe some follow up over the weekend or just some checking in. But I would sort of set the parameters with that person of what that meant when I gave them my email or my phone
Right.
number to text, so they knew that I'm not going to be like answering you instantaneously and dropping
Yeah.
everything for your
Yes.
question. And so I think, again, it's communicating those boundaries, and people respect that, and just being careful in the first place of not oversharing your personal information, because you need to really have a strong boundary between home and work, which again is very hard in this particular job. So
Yeah, absolutely. Which brings me to my next question. There's been a lot of recent changes in veterinary medicine.
mm-hmm.
I think, would you talk a little bit about some of the things, maybe expectations that
Yeah,
people have? And I think we live in a society that they want answers right away. Maybe they want
yeah,
their pets healed right away. And also talk a little bit about the dangers of people doing research online and what
sure,
your viewpoint is on that.
sure. um I read somewhere, it was probably on Veterinary Information Network, which is kind of like the online community of veterinarians that we
Okay.
use. um that honestly, the changes, I mean, veterinary medicine has changed drastically over many, many years, just like human medicine. But
Right.
in the last 20 or so years, about the time I've been practicing, it's just been really, I mean, the rate of change has just been super intense. And I can see a huge change from when I started to to now. And yes, I think the wonderful thing is there's been a lot of advances that have allowed veterinary medicine to be a lot more like human medicine, as far as some of the tests that are available, the treatments, these kinds of things. Um, And that has correlated as well with a change in how we view pets for a lot of people. There's all different mentalities of what the appropriate role of a pet is in your home, but
Right.
a lot of people do look at them as a child and as a very big part of their family. Maybe more so than more people look at it that way than they used to maybe 20 years ago, for
Right.
instance. And so they want a higher and higher level of care. But along with that, on the downside, from a veterinary standpoint, I think, is the level of expectation goes way up,
Mhm.
and wanting to do all of this. But I will say that the willingness to spend money and do what you would need to do to have that level of testing and care hasn't necessarily matched the expectations. So that creates frustration for people because they want all this, but they don't have often a very good handle on what that would actually cost. I think that's because of human insurance.
Right. Right.
They don't, if you say I want to do this surgery your dog needs cost $1,000, what they're not realizing is on a human that might be $100,000, but
Yeah.
they're not necessarily paying that bill, so they think that's so expensive when actually, relatively speaking, it's a huge bargain. So those financial pieces, I think, have become more and more of they've always been an issue, but even more so with the level of things that you can do now with your
Yes.
pet. So,
So health insurance, is that something that you see commonly used with pet owners, or is it something that's underutilized? What's the benefit or risk of using that? Like, I don't know a lot about animal insurance. Could you
yeah,
share a little bit about that?
yeah, and I don't know every plan either. I mean, much like human insurance, every plan is different. There's some that are better than others, I think, but at least in the area that I've practiced, it is not very prevalent. I think there are areas where it is, probably in the more urban or metropolitan areas, probably on either coast, a little more so. I believe in Europe it might be more common, but don't quote me on that. So I think it's been going on there longer, but um, it's you'd have to shop the plans and see what would work best for your situation. I think if you have a lot of pets, it might be
Right.
well worth it. There are plans that really are more catastrophic plans, and then there are plans that are more that actually cover some degree of the preventative care, and they all work a little differently as far as how you are
Right.
reimbursed or how you get those benefits. So it's really hard to compare to really make any general statements, except you really want to do your shopping on that. And it can be, I think, a great benefit for some people. So
Okay.
it's a good thing to look into if you're at all thinking about it. Yeah, especially if
Absolutely.
you're that person who would want to do the highest level of care with something traumatic happened to your pet and you would really want to go all out and do all of that. That might
Yeah.
be especially the person that might really benefit from having that health insurance, and it might be well worth it to them to pay that monthly premium for their pet.
Yeah, because it can add up quickly, and I think it
Yeah,
would give them an option to maybe get treatment that they otherwise couldn't afford. So
absolutely,
it's something to
absolutely.
look into, especially with
Yep,
multiple pets. I have 3 dogs myself, and it
yeah,
adds up very quickly
it
when
does.
you start talking about all the different things that they need. So
Yep.
um, let's see. Let's talk a little bit about, can you think of a memory? I know you've been practicing for a long time, but
Yeah.
maybe a memory, maybe a case that you healed an animal, did a certain surgery. If you could just share a memory
Mhm.
that you're thinking of.
Well, I guess the first one that popped to mind, and I'm sure I could think of many more if I sat and really thought a lot about it for a while, but there was one that I think of that was neat to see how it all played out over time. But there was a dog that came in. I had only been practicing less than a year,
Oh,
pretty new. And I should never have said this, but I remember that morning saying to the technicians, "Wow, it looks pretty quiet on the schedule." And I think it was the first time. Yeah, I
yeah,
don't ever say that. There's like a lot of superstitions in the field, and that's one of the things you
yeah.
just don't ever say. Um, so at the time, I believe that the two older veterinarians who had hired me were both out of the office. Like we were finally at a point where they felt like they could leave because
Yeah.
they must have decided I knew enough that they could leave. So good for them. I'm glad they could do that. But then I'm like, yeah, drinking my coffee, and in comes a dog who had been run over by a lawnmower.
Oh my gosh.
By a family member. So you can imagine how distraught they were. And the technician that I worked most closely with, she went and scooped the dog up, and it was probably an 80-pound dog. I mean, it was pure adrenaline. She went to the back of the car and scooped that dog up and brought it in. And I won't go into the gory details, but there was a lot of blood. There was a lot of mess. There was a lot of commotion. And I was thinking, oh my goodness, so we rushed it to the back, and I just remember trying to, in my mind, stay calm and think about, okay, what, step A, B, C, what do I do here? Because I got to stop this bleeding, but this dog's probably going into shock. And I need to, the leg was kind of hanging off by a thread, basically. So one leg had been partially amputated already. So I knew I had to remove that leg and get the bleeding stopped.
Right.
And on top of this, the owner was one of the owners was a physician, very seasoned physician. So he comes back and watches me doing all this. And I'm like, oh my gosh, I don't know if I could be any more nervous.
Oh my gosh.
I mean, talk about the pressure was on. Yes. So basically I don't even remember what I did, honestly, at this point. All I know is I sedated the dog enough to be able to do this like instantaneous amputation surgery and get everything taken care of. The great story is this dog survived and then lived a long life on 3 legs. Aww. And I would see him year after year. And they were such sweet people, and they'd gotten to the point where they put runners through their house for this dog because he was big and he had a hard time getting his footing with only 3 legs, especially as he got older. And so they had like tile floors or something, and they had put little runners all through their house. So he had his little path. And I always pictured that, and that made me happy that he had that life and that everything had worked out. So that's one of those happy stories. And it's when you practice.
Heroic. That's amazing. Because in that moment, it's like you were talking about earlier, where your instincts kick in. You weren't feeling the pressure. Your knowledge, your instincts, your empathy all kicked in. And you were able to treat the dog and get through it with the owner there, which is a lot of pressure.
Yeah, it was.
I mean, in a hospital, the owner would not be allowed to come back there. So in this scenario, you must have been feeling a lot of pressure.
I was.
But you needed help to probably, deal with that situation.
Yep. So, and that one worked out. They don't all work out, but that one worked out. And, that was a good confidence builder. And, at some point you do have to stand on your own 2 feet without relying on your mentors or the other veterinarians. And so that kind of forced that for me. And I saw a lot of emergencies early on in my career because we did a lot of on-call work. And now that's the thing that has changed too. There's a lot of pet emergency clinics. And so they provide, that's a really nice resource to have because you can go there 24 hours or at least all the way overnight, and they have a full staff, which you're not going to find overnight in a lot of smaller clinics. So, yeah.
One last question for you. I think today in our virtual world and people doing a lot of research, 2-point question for you. First of all, if veterinary clinics are trying to get their message out and build rapport with potential clients or retain the ones they have, how would you suggest, establishing that relationship, so that their clinic can be well known? Would you recommend, having like a Facebook connection to your clients, or, what have you done to keep that relationship going?
Well, I mean, as a clinic overall, I think you have to be as much as you can involved on any of those computer, social media, internet sort of platforms. A foundation of a very good website with the resources that people are looking for, where they can quickly access the information they need, like your hours, your phone number, what to do in an emergency. That's huge for people. And then, of course, along with that, even people even more so, I think, than going to websites now are, maybe finding you on Facebook or Instagram or whatever it might be, and having that all linked together so they can kind of get that whole picture. as well, doing things, educational little pieces, things like that can be really, really helpful too. But yeah, I mean, I think your clinic would struggle, I think, these days if you're not having that really professional online presence that also gives a feel for your clinic and the way you practice, and personal touches, I think would be very important too and would stand out. So does that answer your question?
Yeah, I think that, online, that's what I love about doing marketing is, it helps people to have that connection. Maybe they can't come to the clinic, or maybe they have a relative that lives close to where your clinic is.
Yeah.
They're doing their research. It helps them to get to know you and your clinic, and
Yep.
maybe just a little bit about that. And also, if you have information on your website, whether it's download information or blog posts that gives people information, it really helps them when they can't be with you or at the clinic to have
Right.
access to that information.
Right.
So, which brings me to my last question for you. What is your favorite online place that you recommend for pet owners to go and do research, or, like a reputable place, because there's
Yes.
so much information on the internet, and it can
Right.
be your own worst enemy when you start typing
Yep.
stuff in.
Right.
So
My favorite site by far for people who aren't veterinarians is veterinarypartner.com. So
Okay.
it's veterinary partner, all one word.com. And the reason I like that site is it is a sister site, if you will, to VIN, which is Veterinary Information Network, which is our veterinary site that I mentioned earlier, that any veterinarian who's the least bit progressive is part of that site. That's where we can research ourselves. We can look up any kind of resource. I mean, that site has pretty much replaced textbooks in most cases, I would say. You can consult with specialists, experts, all of that. But anyway, they have a sister site called veterinarypartner.com, which is, all sorts of articles and information. But what I love about it is it's reputable because it's all written by veterinarians. So this is not stuff written by, I don't know, some person who had it happen to their dog once or whatever.
Right.
It's written by veterinarians, and it's reviewed on a fairly regular basis because, I'll pull up an article that I've maybe looked at many times to print out for a client, and they'll say last revised on this day. So they're always updating, with the more current information. And those were my go-to when I will print something for a client to take home that explains whatever the diagnosis or the issue was that day. That's the site I go to. They have an article on just about everything. And everything is, again, good information, talks you through the whole situation, and reliable. So
that's awesome. I will post maybe some of those articles on my LinkedIn. I've connected with a lot of veterinarians there, so perhaps they can use some of that information.
Right.
Well, thank you, Dr. Bisel, for joining us today.
You're welcome.
It's wonderful getting to know you and your history and just the impact that you've had on the pet community. So thank you for your service.
Thank you.
And I look forward to speaking with you soon.
Okay. Thank you, Carrie.
Thanks.